Gestational sac. How to diagnose presence of gestational sac intrauterine? It is very important to diagnose pregnancy. This is a picture of small gestational sac intrauterine. To diagnose gestational sac, we have two important signs. Double echogenic line, like this. There is a fluid and surrounded by inner echogenic line. This is the inner echogenic line, which represents the surrounding of the sac or the pseudocapsularis. And another echogenic line, outer echogenic line, like this, which represents the pseudoparietals. If we see the sign, we are sure this is intrauterine pregnancy. Another important finding, the sac should be eccentric, not in the midline, not between two anterior and posterior endometrial line. This is the presence of the sac and surrounded by echogenic line, and endometrial line is present here, obvious, away from the sac. This is another picture of what's called pseudosac, or just collection of the fluid inside the endometrial cavity. This is not true sac, this is pseudosac, and this is just fluid and not means that there is intrauterine pregnancy. It may due to just collection of fluid or may sign of ectopic pregnancy. Like this picture, there is irregular fluid present within the endometrial cavities. There is no echogenic line. It's not eccentric, so it's not regarded as gestational sac. This is very important because a lot of doctors misleaded by this picture and regard it as intrauterine pregnancy. After that, there is visualization of the yolk sac and fetal pool, like this, and there is another very important sign to confirm proceeding of the intrauterine pregnancy or development of intrauterine pregnancy. Another very important question, how to diagnose that there is non-viable pregnancy or missed abortion or blighted ovum. To make decision to terminate pregnancy or to end the pregnancy and pregnancy failure or non-viable pregnancy, you should have one of the following. First, a mean sac diameter equal or more than 24 millimeter without an embryo. This confirms it's failed pregnancy. Or if presence fetal pool, crown lump length more than 7 millimeter with no cardiac activity. Another methods to depend upon what's called time lapse. If we have two scans, first scan, we visualize gestational sac and wait for another 2 weeks, and there is no heartbeat, so you're sure that this is missed abortion or failed pregnancy. Or absence of embryo with fetal heartbeat after 11 days of ultrasound that shows gestational sac with yolk sac. If we have a previous scan with gestational sac with no yolk sac, we should wait for 2 weeks. If there is yolk sac, we should wait only for 11 days. Thanks a lot.